The topic of today's teaching module is Pediatric Occupants in Motor Vehicle Crashes. What are the injury risks and patterns that result? The purpose of this module is to teach you, 1, how to assess the likelihood of injury to children involved in motor vehicle crashes, 2, to predict the most likely injuries, and 3, to describe the crash conditions to other professionals so as to convey essential information about injury risk and patterns. There are a couple of take-home lessons today, which I'll give to you ahead of time, but they'll become more apparent during the course of this module. And these take-home lessons are, 1, that children are more fragile than adults. 2, the younger they are, the more fragile the children are. 3, airbags and kids don't mix well. Airbags are very dangerous when they deploy in proximity to a small child. And 4, restraint misuse is very frequent among children and markedly increases the risk of injury. As an EMS professional, when you show up on the scene, there are several crash assessment priorities that you should have. The things that you should look for are a child that's found unrestrained in the vehicle, 2, a child that was using a restraint improperly, or the restraints, for instance, a child safety seat was improperly installed. Another thing to look for is the improper type of restraint for the child that's in the vehicle, and also an improper row of seating. In addition, you should look for evidence of significant adult injuries in the same vehicle. Since kids are more fragile than adults, if an adult sustained significant injuries, then it's likely, or it's very likely, that the child may have sustained injuries as well. Another thing to look for is intrusion into the child's occupant seating space. The pattern of injury to child occupants of motor vehicle crashes is dependent on multiple factors, including the age of the child, the restraints used, the vehicle type, and other factors. One very important factor is the type of crash. Now, while there are many different configurations of crashes, 2 of the major types are frontal impacts and side impacts. The relative frequency of the injury to the different body regions is illustrated by the size of the font in this slide. As you can see here, side impacts are generally more dangerous for pediatric occupants than frontal impacts. In frontal impacts, children most commonly sustain orthopedic injuries, followed by injuries to the head, the abdomen, the chest, and the spine. Pelvic fractures also occur in frontal crashes, but less commonly. This contrasts with what happens in side impact crashes, where, in general, there's a greater risk of injury. In side impact crashes, the most common injuries to pediatric occupants are to the head. The chest is the second most commonly injured body region for kids following side impacts, and followed by injuries to the abdomen and the extremities. Injuries to the pelvis and the spine follow. Those were the basic take-home messages that we're going to cover today. So let's go back to the beginning and talk a little bit about crashes in general. Motor vehicle crashes are a major public health problem. Overall, in the United States, approximately 40,000 people are killed each year in motor vehicle crashes. That boils down to about 115 deaths per day, or 1 death every 13 minutes. On top of these fatalities, 3.5 million people are injured. The cost of crash injuries is staggering at $230 billion per year. With regard to kids, in a single year, 2002, 2,095 children aged 0 to 14 were killed in motor vehicle crashes. 3/4 of these, or over 1,500, were the occupants of vehicles. The majority of the remainder were pedestrians. Now, in addition to these over 2,000 deaths to children, more than 250,000 additional children were seriously injured as a result of motor vehicle crashes in that single year alone. Now let's look at this problem from a slightly different perspective. As adults and care providers, we spend a lot of time teaching our children and other children to avoid danger. We teach them, don't play with fire, don't play near the street, don't go near bodies of water, avoid high places, don't go with strangers, don't play with knives or guns. However, we tend to take transportation by cars and other motor vehicles for granted because they're such a common part of daily life. In fact, riding in a motor vehicle is the single most dangerous activity children do from the age of 2 until they're an adult. Let's take a look at a real-life case. In this first crash scenario, the driver fell asleep and struck a tree. He had worked a very long shift overnight and had dropped off his wife at work and was driving home to take care of the baby. The baby was in the back seat in a child restraint. After falling asleep, the car struck this tree. You can see the damage to the front end. You can see the child safety seat in the back seat here. When we investigated the scene and took a close look at the child safety seat, you can see that the shoulder belts here for the harness were in the lowermost settings. And when we look at the back, what we found was that the shoulder straps had in fact torn through the plastic of the seat material. Now this happened because this is one of those convertible seats that's made to turn around. And so when the child is big enough to turn around, what's expected is that the shoulder belts and those harnesses will be routed through one of the upper settings and over this bar that you can see here. And that bar provides the additional sort of reinforcement to hold the belt back. But since this child was rather small, and when they changed the seat from a rear-facing to a forward-facing position, they neglected to move these straps up higher. And so the straps tore through this weaker material of the lower seat back here. This also just gives you an idea of the amount of force that's generated during a crash. So let's think about the occupant kinematics that happens when you're involved in a 12 o'clock principal direction of force crash. What happens is that the car and the seat comes to a stop. The child safety seat continues forward until it's stopped by the belt that's keeping it attached to the seat. The child keeps moving forward until the body is stopped by the shoulder harness. And so the things that continue to go forward are the head and the extremities. And you can see that in this series of photos. So what happened in this case? This is an X-ray of the small child that was in that crash that I showed you. And if you look here in the upper part of the neck, you can see that there's this sort of wideness, this greater separation between several of these vertebrae. You can see that these little bones here that comprise the neck should be stacked quite closely together. And you can see that there's a gap between the first vertebra and the second vertebra. And when we took a CT scan and reconstructed it, we could see what happened. You can see here that there's this very wide gap between the first and the second cervical vertebra. Okay? And what had happened is that actually you see this little post here in the middle. This is actually normally part of this lower cervical vertebra. Now what happened is it basically just got pulled right out like a cork out of a champagne bottle. Now this happened because these vertebrae in the neck actually are formed by the fusion of several pieces of material that start off as cartilage. They fuse and form into a single bone. In this case, what happened is that the child was so young that this maturation process was not yet complete and basically pulled out this single little segment here, which was comprised of the dens and body of C2. It just popped right out like a champagne cork out of a bottle. And you can see that again in these X-rays with a close-up. You can see the normal orientation over here on the right and how it's been pulled up and pulled forward. And as it was pulled up and pulled forward by the weight of the head during the crash. The body got restrained, but the head kept going forward, and it pulled out that part with it. And the results you can see here, the MRI on the left showed bleeding and damage to the spinal cord, and the result in this small child was quadriplegia, or complete paralysis beneath the neck. In summary, this was an 18-month-old, 28-pound female in a front-facing child safety seat with improper belt placement. And it's important to keep in mind that a child's neck is not yet fully developed and therefore less able to withstand deforming forces. A heavy head and a weak neck structure make small children extremely vulnerable in a frontal car crash. And the mechanism of injury, in this case, was tension. Now, this case illustrates something that's very important and an underlying lesson that I'd like to convey today. And that is that a child is not a small adult. If you look at this figure here showing what happens to body proportions between newborn and an adult at 25 years of age, you can see that a newborn compared to an adult has a head which is twice as long, twice as wide, and also twice as deep compared to the adult. So the head is much larger in proportion to the remainder of the body than in an adult. Now this is coupled to the fact that the skeleton is less developed, as we mentioned. In addition, the musculature and the soft tissues and the skin are also less developed. They're much more delicate. And the major viscera are also less developed. So all of these things combined make a child much less able to withstand severe crash forces. Now, as we all learn in grade school, the head bone is connected to the neck bone. And as we have been talking about, children have much more delicate tissues which are binding these things together or connecting these things together. One of the big concerns is rupture of some of these tissues. Partial rupture of the ligaments between the bottom of the skull and the first vertebra of the neck presents as bleeding in the lower skull. Total rupture of these ligaments results in rupture of the spinal cord, which is nearly always a fatal injury. This scenario I'm talking about, where you get a separation of the head from the neck bone, can be seen here in this next slide and in this X-ray image on the right. And you can see here that the space is between the skull and the first cervical vertebra. Okay, and so there's a complete disruption. This is also known as an atlanto-occipital dissociation. So this case is a rupture above the first vertebra. The other case that I showed you was a rupture just below this. Now, it's important to keep in mind that child safety seats work if they're used properly. They can reduce the risk of injury by 71% for children less than 1. Now, for these small children, a rearward-facing seat better supports and protects an infant's head and neck. You can imagine that in the event of a crash, instead of the head going forward and it just being held back by the neck, when the child is rear facing, what happens is the whole seat back can protect the entire head, neck, and back as a unit so that there's no tension pulling those structures apart. It is estimated that from 1975 through 2002, an estimated 6,567 children aged 0 to 4 were saved by the use of child restraints, either child safety seats or belts. Now, in this video here, which shows a crash at 35 miles an hour, you can see what happens if you have a child in the front seat. This is a very bad idea, particularly if there's an airbag there. While the slow motion shows things that look, not too bad, when you take a closer look, you can see that the child seat is flung at very great force against the back of the passenger seat, striking the baby's head. And this would severely injure or kill the child. Therefore, infant seats should not be in the front seat. The danger posed by airbags to children can be seen also in the second crash scenario. In this second case, the vehicle was pulling into a parking lot. The driver braked, perhaps because there was another vehicle that got in the way, and they end up striking this light pole you can see here in the picture at 13 miles an hour, so a relatively minor crash. Now, unfortunately, in this case, there was a 7-year-old unbelted front seat passenger. So you can imagine what happens. You have an unbelted child that's sitting there. When the driver brakes, this child has nothing to really hold him back, so starts sliding forward, which puts them in very close proximity to the airbag. Now here's a picture of the vehicle after the crash. You can see in the left picture that there's a bit of a deformation to the cover of the airbag module, and you can also see up on top there a starring of the windshield. Okay, and we found some hairs in that area where the glass was broken. Based on a reconstruction of all the evidence, we determined that the child's head was in close proximity to this airbag when it deployed, because the child had gone forward while the driver braked. Then when the car hit the light pole, the airbag went off, and the airbag and the cover picked up the child's head and propelled him upward and hit the windshield. Okay, and you can see here on the MRI result on the right that there was severe and diffuse injuries to the brain that resulted from this. Let's take a look at some additional videos that just illustrates the force of an airbag and how dangerous that force can be to a child. You can see here in this video on the left what happens when a side airbag deploys near the head of a child. It takes the head and flings it across the car with the child's body following. So you can imagine the types of forces that are being generated that can cause damage to the head, to the brain inside, and to the neck as well. The video on the right shows a deployment of an airbag in real time, and whereas the slow motion shows this thing that looks like a nice soft pillow coming up, this real-time video I think better conveys the tremendous force and power of an airbag deployment. It's important to keep in mind that children seated in the front seats are at greater risk of injury. You can see here that the risk is reduced by 33% just by moving them from the front seat to the rear. Now, at the current time, the U.S. compliance rate with children seating in the rear is about 90%. We wish we could get rid of that last 10%. Now, while it's important to have the child in the back, it's also important to remember that children should always be restrained. So I'm sure all of us have driven around and seen children sort of standing around or jumping around in the back of a vehicle. This is a very dangerous scenario. Let's look at what happens, okay, with a child in the back seat when they're involved in a forward crash and they're unrestrained. You can see that the child becomes a projectile. In this case, the child gets launched forward and into the dash and through where the windshield would be. In a rearward crash, they can get ejected out the back of the vehicle. Overall, unrestrained children have a far greater risk of injury and death than restrained children. To illustrate this, let's take a look at this third case. In this third case, the driver missed a curve and kept going straight, striking the large tree that was there at the top of the curve. The crash severity in this particular case was 38 miles an hour. You can see that it was fairly severe, and there was significant damage to the front of the vehicle with crumpling of the roof and displacement of the A-pillars here. Now, the case that we're going to talk about is that of the unrestrained 9-year-old female that was in the third row who was thrown against the second row of seats. The result was that she ended up with bilateral pulmonary contusions, a pneumothorax, a mesenteric hematoma or damage to the blood vessels supplying the intestines, a right L3 and L4 transverse process fractures, and also, as you can see in this image on the upper right here, a right scapular fracture. In addition, she had multiple pelvic fractures. You can see in the left lower images. She had a vaginal laceration and a right knee traumatic arthrotomy. This image on the lower right shows the pulmonary contusions, which are quite severe to the right lung. The risk of injury to children in crashes is decreased by 38% by just the use of a seatbelt alone compared to unrestrained children. 38%. Now, while the use of seatbelts or other restraints can improve significantly the risk of injury, it's very important to keep in mind that restraint misuse by a child or their adult caretaker is very frequent, and injury risk is increased by misuse of the restraints. Let's take a look at this fourth case scenario here. In this case vehicle, the driver is going along, wasn't paying attention, and strikes the back of a stopped garbage truck. And there was a 2-month-old in an infant carrier in the back seat. You can look at the damage here on the case vehicle. There's a significant amount of damage to the front. There's crumpling of the hood. The crash severity, based on our investigation, was 32 miles per hour. At the scene, the responders found a damaged infant carrier on the floor next to the rear seat. And you can see here the area where the seat was found, down in the well here behind the passenger seat. You can see there was twisting and buckling of the handle on the infant carrier. Based on much evidence gathered there at the scene, what we concluded with our reconstruction was that while the child was strapped into the infant carrier had been left unbelted and forward-facing in the rear seat. So during this crash, the infant and the carrier went flying forward, striking that seat. The result was that this child ended up with fractures to rib 3 through 6 on the right, as well as a hemothorax, which is bleeding into the chest, which you can see here by this wider area here within the right chest cavity. Remember, in an X-ray, you're looking at from the front, so the left side of the X-ray is the patient's right, and the right side of the X-ray is the patient's left. You can see, in addition to that this child sustained very severe head injuries, including a subarachnoid hemorrhage, bilateral subdural hemorrhages, and bilateral frontal and temporal lobe contusions. Now, it's very important to keep in mind that over 90% of children are actually improperly restrained in crashes. There have been many studies which have clearly documented this. And what we know is that nearly 70% of deaths and 67% of injuries could be prevented with the correct use of child restraints. Now, you can see here in the video what happens when a child safety seat is improperly installed into the vehicle. The child seat ends up going much further forward, and also because the harness is loose, the child goes further still. And based on the film, you can just imagine how hard that child would strike one of the seats in front. The risk of danger and injury is much greater. Now, it's very important. Let's take a look at another crash. This is that of a SUV that was struck on the right side by a vehicle that failed to yield at a stop sign. In our case vehicle, there was a child that was forward-facing in the left rear seat. This child was improperly belted and therefore traveled further forward, striking the DVD player that was installed here between the two front seats. The result was very severe facial fractures. You can see here on the 3D reconstruction of the facial bones, and on top of that, severe brain injury. Yet another case. In this case, the vehicle ran a stoplight and struck another vehicle. There was a 7-year-old right front passenger that was lap belted with the shoulder belt behind him, who was found by EMS to be awake and complaining of abdominal pain. You can see here in this diagram what happened. Our vehicle is in red. You can see that they run the stoplight and strike the front of another vehicle. When we measured the damage, we determined that the crash severity was 20 miles per hour. So based on that scenario, you, I'm sure, predicted that this child had an abdominal abrasion, okay, which went across transversely, as you could see here on this photograph. So guess what the result was? At the time of surgery, which was done because the patient was having such severe abdominal pain, the surgeons found the injury to the colon or the large intestine, as well as an injury to the small bowel. Now, this latter case illustrates one of the problems that we have. Kids weighing more than 40 pounds are too large to fit into most forward-facing child safety seats, but they don't really fit adult seats very well. You can see here this child who is 6 years old. You can see that it's very difficult for him to fit properly into a seat belt. If he sits upright so that the belts fit best, you can see that he is unable to hang his lower leg over the seat edge, and so he has to sit way back, which is uncomfortable. What kids typically do is that they slouch forward so that they can hang their lower legs down. When that happens, it causes very severe mispositioning of the seatbelt. You can see here in the upper left photograph that the lap belt is now way up into the mid-abdomen rather than down low across the pelvis where it can engage the strong pelvic bones. It's now in the soft belly portion. And you can also look that the shoulder belt is now around the right next to the neck, which is very uncomfortable for the child in this normal situation, but also very dangerous in the event of a crash. You can see that sometimes what happens is that because the children are small, they might move their arms underneath the shoulder belt. You can see on the upper right. And this would be very dangerous. You can imagine the loads that would be caused on the neck in a frontal crash if this were to happen. Because the shoulder belt is uncomfortable against the neck or the face or the chin, children oftentimes put it under their arm, as you can see in the lower left. And what would happen in a crash in this situation is that all the forces are generated against the abdomen and lower chest, a very dangerous situation. Or another thing that they do is that they take the shoulder belt and put it behind their backs, as you can see in the lower right here. In this situation, the upper body is completely unrestrained, and you have a lap belt, which is on the soft abdominal portion and not down low against the pelvic area. It's important to understand that a wrongly positioned lap belt crushes the intestines against the lumbar spine. You can see in this diagram on the left the organs that are in the abdominal cavity. There are a lot of small intestines in this large intestine here, which are all quite soft and delicate. What happens in a frontal crash if the belt is up high in this midsection rather than down low across the pelvis is that it pulls on the abdominal wall and crushes all of those soft intestines against the spine in the back. This, in addition to injuring the intestines, can also cause a spinal fracture, as you can see in the diagram on the right. Now, this risk of abdominal injury for child occupants is concentrated in this in-between age of age 4 to age 9 or so. And that's because children younger than age 4 are typically small enough to fit into one of the safety seats, which have harnesses, okay, and better protect the body. And once they get up to about 9 or 10, they fit a little bit better, although not optimally, into the adult belt systems. It's this age 4 to age 8 or 9 region where the body build of these children is particularly ill-suited to the design of seats and seat belts. Now you can see that in this graph here, that just by putting a child into a seatbelt, we can improve the risk of injury by 38%. Now, if you use proper types of restraints, and in this case, if you use a booster seat on top of the seatbelt, you can improve the injury risk by an additional 59%, which is a tremendous benefit. Let's look at another case. In this one, our case vehicle runs a stop sign and strikes another vehicle. There's an 11-year-old left passenger who complains of being unable to move her legs. This child was found to have a transverse abrasion across the abdomen and was found to have been lap belted only with the shoulder belt behind her back. You can see here the very tight shoulder portion and the lap portion, which is out. So obviously, they were not wearing their shoulder belt in the proper position at the time. Let's look at the crash result. This child ended up with an infrarenal abdominal aortic pseudoaneurysm. You can see here on the right-hand side, this is a damage to the main blood vessel carrying the blood out of the heart. In addition, this child had bilateral L2 transverse process fractures, and also, more severely, an L3, L4 posterior dislocation with a quad equina transection with paraplegia as a result. She also had devascularization of the descending colon and a partial transection and disruption of the small bowel, in addition to a partial stomach laceration. You can see the lap belt here across the mid-abdomen at about the level of the umbilicus. You can also see on the left-hand photograph there the large incision which is required to repair all of the intra-abdominal injuries. She also had a very long incision on her back, which was required to fix her unstable spine. You can see the amount of hardware that was placed in on the x-ray on the right. This child remained paraplegic as a result of her injuries. Yet another case. In this one, the SUV in red strikes another car which loses control and crosses the median. There were 3 child occupants in our case vehicle here in the red. The 3 children were in the front passenger seat and the left and right rear seats. You can see here the damage to the front end of our case vehicle on the left lower picture. There was a significant amount of damage. The car that was struck in the side fared far worse. You can see the extensive damage there. The driver of this other vehicle was a fatality at the scene. As I mentioned earlier, our case vehicle, this SUV, had 3 child occupants aged 3, 6, and 7. The 3-year-old was in the left rear, the 6-year-old was in the right rear, and the 7-year-old was in the right front passenger seat. We did a large amount of reconstruction and looking at the evidence that we gathered. We also did modeling, and we determined that the film here on the lower right models what happened during the crash. The child in the right front was wearing both lap and shoulder belts. The two children in the back were not in booster seats and had their lap belts on, but had the shoulder belts behind their backs. So what were the results of the crash? Well, first, the adult driver, despite the fairly significant severity of the crash, sustained no significant injuries. The fact that she was wearing her seatbelts and had an airbag as well certainly helped to protect her very nicely. The 7-year-old in the right front passenger seat was wearing both a lap and shoulder belt. Optimally, she would have been in the rear seat. You can see here in this series of images that she sustained bruises. You can see the marks left by the shoulder belts here across her right upper chest. She also had a bruise across her lower abdomen and pelvic region from the lap belt portion. Now, interestingly, this child, when she came in, had some neck pain. We got x-rays, which were negative. She continued to complain of pain, so we got flexion and extension x-rays, which were all negative. We got a CT scan, which was negative, and she was sent home. Several days later, she returned back complaining of double vision, and that's when we got a repeat CT scan, and you can see that on this middle image here, and it shows just a small amount of blood right here at the base of the brain and at the start of the spinal cord. And this was diagnosed as a very, very minimal atlanto-occipital dissociation injury. This bleeding is caused by a rupture of some of the membranes connecting the skull to the neck. So let's take a look at what happened to the 6-year-old right rear passenger. This child had shoulder belts behind the back, and the lap belt was slack as the child was slouching down. You can see here in the model with the video that the child goes forward and indeed ends up striking the back of the front passenger seat. The result was that this child sustained skull fractures and brain injuries. You can see the skull fracture here in the upper right. It's sort of oriented in a vertical fashion. So this child actually struck the seat frame, which is metal piping, which is covered only by very thin layers of padded material and leather or fabric, and that's because most of the cushioning is in the front, and so when the child struck this, very quickly got loaded by that metal frame, causing that skull fracture. This child also sustained lumbar, L2, L3, L4 spine fractures. Fortunately, did not sustain a cord injury. This child also sustained multiple intestinal injuries from the lap belt based on the scenario that we've seen multiple times now. Now, interestingly, this child, if you look at the CT scan here in the middle image on the bottom and also the left lower image, which is an MRI of the neck, you can see a small amount of blood right at the brainstem here. These are basically the same findings as in an older sister, but just slightly more apparent here. So this child had a slightly more severe atlanto-occipital dissociation. So both of these children are very lucky. Typically, these atlanto-occipital dissociations are fatal injuries, but here they were right on the cusp of getting a very severe injury. The child ended up getting surgery for a fusion and required a halo for many months. So guess what happened to the 3-year-old left rear passenger? And this child, as you can see here from the belt configuration, was also seated with the lap belt on only and with the shoulder belt behind the back. This child ended up with multiple intestinal injuries and pelvic fractures from the lap belt. In addition, and you can see here this x-ray from this youngest child that looks very similar to the older siblings. Again, there's some bleeding here right near the brainstem. and the spinal cord. And what this child had was a most severe atlanto-occipital dissociation. Again, not fatal, but more severe than her older siblings. So to summarize, in this crash, the adult driver had no significant injuries. The 7-year-old right front passenger had an atlanto-occipital dissociation, which was very mild. The 6-year-old right rear passengers had skull fractures and brain injuries, lumbar spine fractures, and multiple intestinal injuries. And on top of that, had a slightly more severe atlanto-occipital dissociation, which required operative fixation and a halo for many months. The 3-year-old had, again, intestinal injuries and pelvic fractures from the lap belt. And this youngest child had the most severe atlanto-occipital dissociation. This case here, I think, shows very nicely one of those take-home lessons which I had mentioned at the beginning of this module, and that is that the younger the child, the more likely they are to sustain a serious injury as a result of a crash. And this case as well also highlights again the importance of the proper type of restraint. Remember that the addition of a seatbelt for a child improves the risk of injury by 38%. However, because seatbelts are designed for adults and not for kids, if you place children into a booster seat, which allows them to put the belts into the proper position, you can improve the risk of injury by an additional 59%. Now, if your kids are like my kids, they'll probably ask you why. Why do I have to be in a booster seat? And this is what you need to tell them. You're taller in the car. It's more comfortable, and the seatbelt won't bother you. You can see out the window, and you're safe and sound. You can see here in the photograph on the left that when the child is in a booster seat, the lap belt remains down low near the pelvis where the bones can support the forces from the seatbelt. And you can see also that the shoulder belt is routed properly over the shoulder and not next to the neck where it's uncomfortable for the child and dangerous as well. Unfortunately, at the current time, we have less than optimal booster seat usage in the United States. As of 2002, it's less than 20%. At the current time, it's less still than 30%. A tremendous amount of public education is required. Let's now look at one more case. In this scenario, the driver missed a stop sign and was struck on the left side by a semi-trailer truck. There was a 16-month-old child in a forward-facing child restraint in the left rear seat, and you can see that there was a significant amount of damage and intrusion into that space occupied by the child. You can see in this photograph that the door intruded directly on the safety seat and caused a significant amount of deformation. The extent of the damage here was 20 inches of intrusion at the left door. And given that photograph, the crash result is not unexpected. You can see here that this child sustained a left tentorial subdural hematoma on the CT image on the right-hand side. This child also sustained a splenic laceration. The spleen is located on the left side, just inside the lower ribs, and you can see that there was a damage to the spleen in that area. I've showed you many cases today. I hope that they illustrate the take-home lessons, which are that children are more fragile than adults, and the younger they are, the more fragile they are. Airbags and kids also don't mix very well. Airbags can be very dangerous. In addition, it's important to keep in mind that restraint misuse is very frequent among children and markedly increase the risk of injury. From an EMS perspective, the crash assessment priorities are to look for a child that is unrestrained, to look for restraints that are improperly used or installed, to look for the improper type of restraint. So if you get a very young child and they're in a booster seat, that's wrong. If you see an infant that's in a forward-facing seat, that's wrong. Okay. It's also important to keep in mind that the improper row of seating obviously is associated with a greater risk of injury. In addition, significant adult injuries in the same vehicle are an indication that you should have a high index of suspicion for child injuries, again, because children are more fragile than adults. Lastly, intrusion into the child's occupant space is a marker for significant risk of injury. So I've talked a lot about improper restraint use. What exactly are the appropriate restraints? For infants up to 20 pounds and under 1 year of age, they should always ride in a rear-facing car seat in the vehicle's back. Okay? And in fact, I would say that infants should be kept in a rear-facing seat as long as possible. I wouldn't necessarily use 1 year. If your child is 1.5 years old but still small enough to fit in that seat and is not complaining, I think it's safer to keep them rearward-facing. How about for bigger children? For toddlers from 20 to 40 pounds and usually up to about 4 years of age, it's appropriate to put them into a combination seat. Okay. Now, these forward-facing seats are characterized by a 5-point harness. For these smaller children, they need to be in the 5-point harness. Okay. And that's because the belts are, don't fit them properly. For bigger kids, booster seats are appropriate, and this is for kids that are greater than 40 pounds and up to 80 pounds, also up to 4 foot 9 inches tall. In general, this is in the range of 4 to 8 years old. Now, it's very important to keep in mind that it's the size and the stature that matters and not the age. I just give the age guidelines as a general rule of thumb. What's important to remember is that 40 to 80 pounds and up to 4 foot 9 inches tall. Children are okay for regular adult 3-point belts after reaching 4 foot 9 and 80 pounds. I'd also like to conclude with some general reminders. The crash and the vehicle information that you see at the scene is essential for properly triaging the patient. And this information should help you to predict the most likely injuries, and properly relaying this information to medical control and to the medical team will assist them with the proper assessment and care of the patient. Thank you very much.